I'm sure everyone knows the Senate is spending a lot of time these weeks on health care reform. And in particular, we have legislation that our majority leader, Senator Reid, has put together, taking parts from the Finance Committee reported bill and parts from the Health and Education Committee reported bill. This is the bill that we have before us, and we will be debating this pretty much for the rest of the year, and hopefully be able to pass that through the Senate and go to conference with the House before Christmas. Well, this is very important legislation for New Mexico for several reasons. First, we've seen the cost of health care and the premiums for health care insurance go up and up and up in our state, and the projections for the coming years are that they're going to go up even more. There are estimates that New Mexico may experience greater increases in its health care premiums than any other state in the country. At the same time, of course, we have more uninsured in our state as a percentage of our state than virtually any other state. So there are major reasons why reform of the health care system is important to us. Yeah, this bill tries to provide coverage for a lot of people who currently don't have coverage. It does so by setting up in each state an insurance exchange where people could go and obtain coverage, buy a policy, compare policies that are being offered, choose one, and if their income is less than 400% of poverty, which of course is the circumstance for many in New Mexico, then there is some level of assistance provided by the government to help cover the cost of that insurance. So this will allow a lot of the folks who currently do not have any coverage in our state to obtain coverage, to pay what they can for that coverage, and then to have assistance to pay the balance of the cost. The new legislation, which takes effect really in 2014, in that the state at that time would be required to cover more people under Medicaid than it does today. The legislation we're considering in the Senate provides that the federal government will cover 100% of the cost of that additional coverage for the first 3 years, and after that, for our state, the federal government will cover 95% of the cost. It'll also cover 100% of the cost for additional children in the Children's Health Insurance Program. So there is, in the distance, like 6 or 8 years from now, you can see some additional cost to the state, but it's not near as significant as we have been paying in the past to provide health coverage for people. And it will provide coverage for a great many New Mexicans who don't have coverage today. The hope is that this will be the main item of interest here in the Senate and the issue we debate in the Senate for the remaining time between now and when we recess for Christmas, probably about the 18th of December. There'll be a lot of opportunity to consider amendments and changes to the bill during that time. Of course, I'll have some proposals I'll make along those lines as well. Thanks very much for watching. Appreciate your interest in the policy issues we're trying to deal with here in the Senate.